I think just something that's unique, particular to our building at East, is that we have two programs that we offer, and that's the diabetes program, where our nurses we have special training in the diabetes program, and we have a part-time nurse practitioner that visits every week for our diabetic residents. And what we're doing is we're trying to get them off like the sliding scale, where they're having to have a finger stick 4 times a day, to where they maybe only twice a day. So that's something that is a quality of life issue for them that we can provide, and it provides better control of their diabetes. We also have our dialysis center that's DaVita, that's housed at the facility. They rent that space. So we partner with DaVita and offer that to the residents so they don't have to travel to other facilities. They can go over and get their dialysis, come back, hopefully be able to participate in their rehab or their therapy. One of the advantages of having the in-house dialysis centers, they can come back, they can rest a little bit, have that time to recoup after dialysis, and be able to participate in therapy, so that they can be able to go home quicker and get the full benefit of the therapy program that the facility offers. Our staffing is based on acuity. We do acuity-based staffing. So some of our units are staffed differently than some of the others. We have on our rehab wing. They require more staff to take care of those particular needs. We have 24-hour nursing coverage. We have at least 2 shifts a day with RNs. On our rehab wing, we have RNs around the clock. We have a full-time staffing coordinator that works on a daily basis to make sure that we have the adequate staffing in the building. And we look at that every single day to make sure that we have what we need to provide the care to our residents. We have a falls program at the facility to help reduce and limit falls and limit injuries with a fall. We will have falls. That is something that with the aged and with chronic illness that people are at high risk for. But we work very hard to manage those falls and less frequent falls and minimize the injuries. We do utilize restraints very minimally. Usually what they're used for is like a positioning device, to help a resident so that if they lean forward in their chair, they're not falling out. Sometimes it's a lap tray that the resident can remove on their own, or an alarming seatbelt to alert the staff that the resident is getting ready to transfer unsafely. So those are some of the types of restraints we use in the facility, and we're at just about 4% right now in the facility as a whole, and we're always working toward reducing that for quality of life again for the residents, so that we don't have to use a restraint, but we can have other means, activities, when they're going to therapy, when they're dining, that the restraints aren't in use when they're supervised. All of our nurses are IV certified, and so we have the ability to take just about any IV that's needed for our residents. As far as like payment goes, our IVs are covered through most of the insurance. While you're at our facility, we have a pharmacy that will deliver your medications, and so that you don't have to worry about bringing anything from home. We utilize the Part D with Medicare. We have private insurance, we have regular Medicare and Medicaid, and so all those are avenues of payment for your pharmacy. And we have a pharmacy that delivers twice a day, so that you wouldn't have to wait very long once you're admitted to the facility, and we'll have those medications on hand for you. As far as interdisciplinary team approach for our residents, I think one of the unique things that we can offer is we have a full-time chaplain, and he is not there just for spirituality, but he's also there just for coaching and mentoring, for assistance with if we have a resident that is having a hard time wanting to go to therapy or refusing to go to therapy, or even taking a shower, or even wanting to eat a meal. Sometimes they just need that extra person that can come and spend some time with them, sit down with them, let them talk, and he's there to listen. And a lot of times he can provide that encouragement that they may need to, to make that decision that they would like to, to eat a meal, or to attend their therapy, or even take a shower. That's a little bit. That's just one more thing that we have that we can offer those residents. Or if they're just dealing with any type of grief, it's not just losing a loved one, but being taken from their home. If they're going to be a long-term resident, just that transition to long-term care, that they have that person that they can, talk to, and they can listen and provide some counseling for them and kind of help with that transition. Signature and their revolution to change long-term care, I think is one of my favorite parts of Signature, because we look at the resident as a person, and each individual that comes to the facility, we all as a group, as a team, try to get to know who that individual is, who they were, what their background was, and try to, develop a plan of care that meets their particular needs. It could have been, somebody that worked night shift their entire life, and so they're awake at night, and they want to sleep during the day, or, a lot of facilities, tend to be a little bit more institutionalized. They tell the resident when to get up, when to eat, when to take a bath, when to go to an activity. And here we just really try to give that resident a choice, give their choices back to them, so that they can choose when they want to eat, when they want to get up in the morning, what activities they want to attend or not attend, if they want to eat in their room or go to the dining room, just things like that, and just trying to personalize some of the things that they enjoyed doing, before they came, to long-term care, so that we can provide some of those activities and get them out and get them involved, and just offer them, whatever makes them happy. And I think that is something that people enjoy, and that makes us different.